Hello, everyone. Just wait another 15, 20 seconds as the participants join in, and then we'll begin. Okay. Good morning, afternoon, and evening to all who are listening, and welcome to this webinar on safeguarding public health, managing conflict of interest and interference in alcohol policy to support safer implementation. My name is Adam Karpati. I'm Senior Vice President at Vital Strategies, a global public health organization working in partnership with governments and civil society organizations around the world to advance public health policies around non-communicable diseases, injury prevention, and other topics. This webinar today is co-sponsored by the WHO Regional Office for Europe, the Pan American Health Organization, and Vital Strategies. We have a distinguished set of speakers who will be providing presentations to you all that will be extremely stimulating. Just some logistics, please. There will be a question and answer, a brief question and answer period where I will pose questions to the presenters. You can submit question ideas and proposals in the chat or in the Q&A function. We encourage you to use those. When posting into the chat, please include your organizational affiliation. There's interpretation available in Russian and Spanish, and there was just a note in the chat about interpretation, how to do that. I think that's it. This webinar will be about an hour and a half long. So without further ado, we're going to kick off. The context for this, of course, is the ongoing global effort to address the extreme public health and development burden of alcohol consumption. The toll is well known, or maybe not so well known to everyone. WHO estimates approximately 3 million deaths a year attributable to alcohol. In many countries of the world, there is the need for much more intentional, much more specific and ambitious alcohol policy to reduce those harms. The WHO, the World Health Organization, has put out the best, most effective, most cost-effective, highly impactful policies that countries should adopt under the rubric of the safer technical package, and we're going to hear more about that. And so as governments consider the implementation of the safer policies, it's important to consider the voices that will be seeking to influence those decisions. And that's what today's webinar is really all about, to be aware of, to understand, and to mitigate any interference with implementing best public health policies. So with that brief introduction, I'm going to ask our first speaker to kick us off. She's Maristela Montero, the Senior Advisor on Alcohol at the Pan American Health Organization. Over to you, Maristela.
Thank you very much, Adam. And again, I'd like to thank Vital Strategies and their office in Europe to collaborate with us in this webinar, which is very timely, especially as we begin to or continue, it have increased the efforts to implement the SAFER initiative in the region. And we know also the WHO is moving towards the adoption of a global alcohol action plan, but both actually are based on the current and existing global alcohol strategy that is the framework that guides us since 2010 on the efforts to reduce the burden of alcohol. I'm going to be brief and just give an overview of conflicts of interest and why it's important, why it matters to member states to understand and act on it. So I'm sharing my screen. Can you all see this?
Yes.
Okay, great. So first of all, a very brief review of what is the SAFER initiative. SAFER is an acronym standing for 5 key interventions or policies or policy areas that have proven to be cost effective, but also highly effective in reducing consumption and reducing the harms related to alcohol. And it outlines the technical package, outlines the ways the country can implement these policies. And in the broader sense, SAFER actually extends to other policies during implementation and other activities that are envisioned and are reflected in the global strategy. So it's not a replacement, it is just an easy way to have these conversations at country level. It is a partnership with WHO, the UN Interagency Task Force on NCDs, the UNDP, civil society organizations that are working together to assist countries in the implementation of the strategy. And you can see on the right side what it stands for. The S for alcohol availability restrictions, A on drink driving countermeasures, F facilitating the screening, brief interventions and treatment. The E reflects the policies on advertising, on marketing control in all aspects of it, and R on the raise prices through taxation, excise taxes as in other policy, pricing policies. So the country strategies that the initiative proposes are summarized here in terms of implementing the regulatory frameworks, by law, the regulations that under these 5 areas to ensure that there is enforcement, a sustained funding, and multi-sectoral collaboration. We also, it's important for countries to monitor and do surveillance about alcohol consumption, harms, mortality, and know if those policies are making an impact, sustained impact also over time, and they need to be revised from time to time. And this will generate reports to governments, but also the society at large and on the investment being made on these strategies. And the third area is the protection, that for these policies to work, it is important to safeguard the public health objectives, which is to reduce the harm and reduce the consumption of alcohol. And for that, you need to use the best available evidence, and in discussions with any partner, any stakeholders, we need to disclose and manage conflicts of interest. So what is called the best buys, they're reflected in the NCD global plan and became very known in the world of public health, they are outside the current competence of the health sector, several of them, or they require the involvement of other sectors, as you can see listed here. Alcohol has connections with agriculture, employment, education, energy, environment, finance, health, housing, legislature, sports, trade, urban planning. So it cannot be only in the hands of ministries of health to adopt policies without those sectors. And these policies are of regulatory nature. So you need to be talking with the policymakers, with legislators about them. And because alcohol products are legal and they are sold in many countries, they face strong opposition from those producing, manufacturing, or distributing, marketing, and selling those products, because the regulation imply control on that business. So this is what we say is the elephant in the room. It is the alcohol industry that today is composed by multinational corporations, and alcohol, which is an unhealthy, unnecessary product and an addictive substance. So what are the discussions that you need to have with those who produce this type of substance, and how not only they can be regulated, but how you balance commercial and public health interests. And there are many reasons, despite this substance or alcohol being legal, that you have a connection with health and other social, economic problems in society. And it is known to be a driver of the NCD epidemic, road traffic mortality, violence, and other mental health issues. And this is just to give you a hint on the connections of all the alcohol brands, alcohol producers around the world. And we have a centralized body that lobby for their interests. And their interest is to sell alcohol, obviously. And when we talk about these highly effective policies to reduce the harm from alcohol, we are talking about reducing consumption. So this is an inherent conflict of interest. Public health wants to reduce consumption and in order to reduce the harms, and the industry goal is to increase consumption and increase profits from selling alcohol. And as we have documents in the region and that already talk about how these actions of these players have an impact and have been leading to interference and influence in the alcohol policy process in various countries. So we can call the alcohol industry a commercial determinant of health. And there are some commercial determinants that can be for good, but in the case of an addictive substance that is not healthy for people, the impact is negative for sure. And what we're going to see today are several examples of such interference, and we need to reflect on what can be done about it.
Just a reminder on time, Maristella.
Yes, I'm finishing up. The implementation of these safer policies will require then the understanding of the management of this conflict of interest. Is not to block or prohibit the sale of alcohol. It is a dialogue that needs to be very clear, transparent, and understood by all around it. And the ways that this interference happens is what at the core of what we're discussing here. So with that, I hope you have a good webinar, and you're going to see in many ways the examples of what I just referred to. Thank you.
Thank you very much. We're going to move now into our presentations. And the first one is going to be from Jim McCambridge, Chair in Addictive Behaviors in Public Health at the University of York in the UK. Over to you.
Thank you, Adam. I'm just going to share my screen. Can you see that?
Yes?
Yes, yes, we can.
Okay. Just to acknowledge the Wellcome Trust in particular, who were the main funder of the transformative research on the alcohol industry policy and science research program, which I'm going to be speaking about today. When we began this program, we undertook systematic reviews of scientific literature in the areas of CSR, policy and science. And I'm only going to focus on science area now. And the presentation largely describes how we've added to a literature which could be characterized by having a high level of concern about industry involvement, but little prior study. And one important early finding was that alcohol industry involvement in science was much more extensive than we'd previously realized. We had been, I guess, most attentive to the most policy relevant research, and we found that most alcohol industry involvement in science is in less directly policy relevant areas such as chemistry, biology and agriculture, rather than epidemiological studies or policy studies of health harms and how they may be arrested. When one moves to the more policy relevant areas, as you will be aware, there has been a long-standing controversy about whether alcohol is cardioprotective or not. And we undertook an examination of systematic reviews in this area. And we found that systematic reviews, which were undertaken by authors with histories of alcohol industry funding, were designed differently from other authors. And without exception, every review published favored the sponsor interests. So all found that alcohol was cardioprotective, whereas in the other reviews, the literature was quite mixed. In some instances, there were findings of cardioprotection, and in other cases, there were not. So a study which we're just finishing up now follows on from the examination of systematic reviews by looking at all of the epidemiological studies that have been included within those reviews. And this is a co-authorship network diagram which describes authorship patterns in this literature. And in total, we find that almost 10% of all studies make some declaration of alcohol industry funding, and there may also be other studies where declarations have not been made. And this authorship structure looks rather different than in other areas, where there is much more evidence of collaboration among authors and a bigger central co-authorship network. So the ways in which this literature is written is somewhat distinct from other areas. And industry funding is not confined to specific sub-networks. There's industry funding across the literature as a whole. Now, I'm going to spend most of my time today describing the findings of an interview study which I undertook with Jim and Mitchell. And we published 3 papers on the experiences of doing alcohol policy relevant research. Just to say a little bit about the methods used in this interview study, we interviewed 37 researchers. We had intended that be around half and half, those who had received industry funding or worked with industry and those who had not. It turns out that the majority of those that we had interviewed has some form of prior relationship with the industry. We also recruited those 37 researchers from 44 invitations, so we had a very healthy rate of participation. We undertook semi-structured interviews based on our systematic review previously, and invited researchers to talk about how industry funding issues figured within their careers more broadly. And we found there were 3 groups within our data set. We had 7 early career researchers who had applied for industry funding, and we found that there was no evidence of interference in studies that were funded to do, but that there was something of what we call the snowball effect. And that was these early career researchers found themselves in networks with other authors alongside industry actors and with industry funding. And then we had a rather larger number, 16 researchers who had decided to have some form of relationship with the alcohol industry somewhat later in their careers. And for most of these people, they were performing roles for industry social aspects organizations, and most of those decided to stop that at some point in time because they found the experiences of trying to make their research useful to be disappointing. And then finally, we had 14 researchers who had themselves decided to avoid having any relationship with industry, but in fact found that unavoidable because of the extent of industry presence within the research community. So what I'm going to do now in the next set of slides is present to you direct quotations from the researchers that we spoke to. And so this is intended to give you access to the words and indirectly to the voices of the researchers themselves. I will start with the researchers who sought to avoid contact with industry. See in this first quotation, a seemingly trivial interaction with an industry actor led to a persistent relationship that was unwanted by the researcher. And then in this second quotation, you see that something that the researcher described as something that was innocuous actually went on to become something else. Again, this was someone who was seeking to avoid interaction with industry. Going on then, we found among this group very strong evidence of extensive surveillance of the research community by industry actors. So in the first quotation on this slide, you see evidence of industry actively monitoring the peer-reviewed literature from its earliest stages, right from the submission of abstracts to conferences and long before papers become public. And then in the second quotation, you see something different, and this is not merely surveillance. This is an intervention designed to harass the researcher involved. And the picture that emerged from these interviews was that researchers who were doing research and publishing findings which was contrary to the business interests of alcohol industry actors were routinely surveilled and harassed, with a view in the latter instance to disrupting the research that was being done. And then moving on to the second group, we had 7 researchers who sought alcohol industry funding to get their research careers up and running. And among these 7, this was an unremarkable part of their socialization research community. And as their careers progressed, they found that they were operating in networks alongside other people who were funding relationships with the industry, and were in some senses trapped in those networks, partly because of the controversial nature of alcohol industry funding. We found their reputations were affected. This was onerous for them to make decisions about. And so there was a lot of angst and worry about how to continue one's research career having earlier had industry funding. And then finally, the third group were those whose experiences involved working, deciding to make or seek to make the research useful by working with industry organizations, typically social aspect organizations. And again, you get a sense of these researchers being caught up in something that was more than it had first seemed. And most of these people abandoned, in some instances relatively quickly, and in other instances after some time. And then quite recently, we've published a further paper, which is, unlike the previous papers, not so much about the experiences of industry involvement in science, but researcher views on conflict of interest, and more directly relevant to the theme of today's webinar. And in this paper, in this study, what we've done is we've taken all 37 researchers' views together and sought to examine them as a whole. And in this first slide, you might think that the first quotation refers to someone who had received industry funding. In fact, this was someone who chose it not to. And similarly, the second quotation is someone who had received industry funding, but had a strong sense of the importance of the researching community, integrity of the research community. And so on both sides of what has been a very polarized debate, our main finding in this paper is that there's an extraordinary and surprising degree of common ground among researchers, regardless of their prior relationships with the alcohol industry. And we then tried to dig a little deeper into the decision making involved and how that impacted on the views that people had. And what we see in the first quotation is a strong sense in which the precarious nature of research careers that are based on project grant funding is an important part of the explanation for the state of affairs that we have. And in the second quotation, we see that, as we said in the paper, the times they are changing. It's very much the case that the climate within the research community is now more skeptical or hostile about research funding emanating from industry, largely due to findings in other areas, but that leads researchers who may have previously been more open to industry funding now to be more circumspect about it. And then I think it's important that we don't overstate the extent of the common ground. So on this slide, you have the first quotation. So this is from someone who has had a long career in receipt of industry funding, performing roles for industry organizations. And their view is that the conflict of interest is principally manageable by the individual. In contrast, in the second quotation, you see a strongly opposing view from someone who will have no truck with that argument, even to the extent of finding it not to be rational. So we looked at where this left us in terms of the research community as a whole and thoughts on the way forward. And all three of these quotations come from people who had prior relationships with industry organizations of different types. We find similar themes for the most part among those who did not. And funding scarcity is a root cause of the situation. And there's a strong sense in which we can't or shouldn't leave it to individual researchers to make decisions about whether or not to accept industry funding. There's an important role for institutions, scientific institutions such as journals, academic societies, universities, and research funders in moving this situation forward. Now that's the interview study.
Sorry, Jim, just one more minute. Sorry to interrupt.
Okay. I'm just going to very quickly then mention some other findings from further studies. So we found that alcohol industry actors intervene in scientific debates to legitimize themselves as scientific actors. We find that especially when one gets closer to influencing policy, the peer-reviewed literature is in fact marginalized, and a biased alternative literature is instead. And all of this may seem horribly familiar and reminiscent of the tobacco industry, and that's because these strategies and tactics adopted by the alcohol industry have in fact been co-designed with the tobacco industry and public relations organizations since the early 1950s. And in a paper that's just about to come out, we've examined the best known example of the integration of tobacco and alcohol industries, and that is Philip Morris and their brewing company. And found that it is appropriate to challenge the idea that the tobacco and alcohol industries are in fact separate entities. And we found in seeking to influence policy, they agree a division of labour, and there are circumstances in which alcohol industry actors do take. So what sense does one make of this? My final slide. Well, probably on the basis of these findings, it's no surprise to hear me declare that our conclusion is that conflict of interest in alcohol science is a major problem, and there is a mood now within the research community to change that. And this is very much in keeping with wider attention to conflict of interest with policymaking. I'll leave it for my co-presenters to follow up on that. Thank you.
Thank you very much. Thanks especially for the quotations, the qualitative information, extremely compelling. Okay, our next speaker is my colleague, Nandita Murkutla. She's the Vice President, Global Policy and Research at Vital Strategies. Over to you, Nandita.
Thank you, Adam. So in my presentation today, I'll talk about the challenges to regulating health harmful industries, particularly the imperceptible pressure from conflict of interest. Let me just make sure it's working. Okay, so in my presentation, here's what I'll go through. First, I'll describe public subsidies to alcohol as an example of how conflict of interest is exerted. I'll then describe this as a wider phenomenon that applies to NCD causing harmful industries at large. And finally, I'll draw lessons from across efforts to regulate harmful commodities, focusing on experiences in tobacco control. So to begin, we recognize a fundamental conflict of interest in government promotion of unhealthy commodities. In fact, we would describe these as perverse because economic incentives that are offered to these industries go against the fundamental interests of the payer. Financial incentives to tobacco, alcohol, ultra-processed foods cause significant negative health, social, economic, and ecological costs. And so they're against the interests of society. Bear with me. Okay. And yet we find that there's evidence of billions of dollars being spent in public subsidies to alcohol companies. Last year, Vital Strategies released a report called The Sobering Truth, in which we described a range of public incentives that go to the alcohol industry. We found examples of tax breaks, tax rebates, marketing deductions, and even development assistance. And what we found was that, in fact, there's a class of incentives called discriminatory incentives that are specifically targeted towards benefiting the alcohol industry, and we describe these as particularly damning. What we also found is that the beneficiaries are most often transnational corporations. So these are resource-rich transnational corporations headquartered in high-income countries selling to cash-strapped low and middle-income countries. The annual revenues of these companies stands in stark contrast to the amount of money that would be required to implement all of the NCD best buys, and yet here we have them as the beneficiaries of these sparse public funds. Our report has a number of case studies that I would encourage you to read. Here, for example, is one such case of development assistance going towards alcohol companies. This one comes from the European Bank for Reconstruction and Development that provided more than 422 million in development assistance for investment in breweries. And this despite the fact that many countries in Central and Eastern Europe face an alcohol epidemic. We also found examples of production subsidies. For instance, the Ugandan government providing production subsidies to beer production. And this despite the fact that Uganda has the 7th highest rate of alcohol consumption in Africa, and it's the leading cause for years of life lost. Ironically, we found that the World Bank hailed this as a great economic model and encouraged its emulation in countries like Tanzania. One final case study that I'll describe is marketing deductions. As has been described before, marketing, we know, exposure to marketing, advertising of alcohol is responsible for increase in alcohol use. And yet we find examples of incentives given to advertising and marketing, in this case, deductions in the US provided to alcohol producers, which in 2017 alone was about 1.5 billion saved for beer advertising alone. What we're seeing and what we've identified in our report is a systematic pattern that exists across health harmful industries. Profiteers from the sales of unhealthy commodities are most frequently transnational companies located in high-income countries and selling to low and middle-income countries. And this applies to tobacco as it does to unhealthy foods. What we also see as common across industries is that maintaining status quo and a policy-friendly environment is the key driver of the corporate political activity and marketing activities. And it works. So for instance, in this analysis, in 2020, corporate influence was at the heart of poor NCD implementation. And it was corporate influence not just in the visible form, in the form of direct lobbying and advocacy, but it's in all those imperceptible ways in which conflict of interest is stitched into institutions as well as into the fabric of society. And so this really underscores the importance and need for a cohesive approach to regulating health harmful commodities. Health harmful commodities share a lot that's in common. Here, for instance, is a model that describes how commercial determinants of health work, how they exert pressure on environments, consumers, and ultimately health. And what these analyses have identified is a unified focus on shaping environments to make products accessible, creating a culture of use, and in particular, deflecting responsibility from regulation of environments onto individual lifestyle choices. And there is a common playbook. Here again is an analysis done by Vital Strategies in which we document the common tactics and the common arguments that are frequently used. Common tactics include, as other speakers have noted here, capturing scientific political establishments and shaping public opinion. Common arguments including presenting the commodities as an economic good, the industry as a legitimate and responsible actor, and efforts to regulate as regressive, paternalistic, and simply no fun. So what can we do? Drawing from tobacco control, as well as emerging evidence in other areas of commercial determinants of health, I present just a couple of ideas. One is vigilance is vital. The industry continually innovates, especially with the rise of social media, and lack of data is a major issue. Here, for instance, are two initiatives that we're a part of. The STOP partnership that shines the light on industry practices, and recognizing just how much social media is a contributor to both sales and marketing of unhealthy commodities. We've launched a product that essentially monitors systematically digital marketing and uses that to support governments and civil society partners in enforcing marketing restrictions. So vigilance is one of the crucial ways to counter it. Second, counter marketing is crucial. Here is a publication from Vital Strategies that describes frequent marketing tactics by the alcohol industry. And essentially, we argue that framing the right message to cut through the noise and the lies is crucial. And recognizing that in counter marketing, we're not just counter marketing the product, but the company, the industry, and the habit at large. And to do all this, classic principles of social and behavior change apply. And we've got evidence from across unhealthy commodities to draw from. And finally, and crucially, keeping a distance. Tobacco exceptionalism is unique and a cornerstone of tobacco control. The tobacco industry does not get a seat at the table, not even when it is state-owned. And this is codified in WHO's Framework Convention on Tobacco Control that obligates all signatories to implement. And it serves two purposes. For one thing, it provides a framework for minimizing interference and increasing transparency, but it also establishes a social norm, makes it an embarrassment for policymakers to share the stage with harmful industries. And so in conclusion, expect conflict of interest to occur imperceptibly, and it works. Its influence is significant. It merits a coordinated approach to regulating harmful commodities. That's not to say that we tackle all industries at once and unify, but it is crucial to address similarly what is an essentially common playbook. Some recommendations: data is vital, as is vigilance. Counter marketing is crucial, and fundamentally, keeping a distance from policymaking must be the norm. Thank you.
Thanks very much, Nandita, for that stimulating presentation. I will just remind folks, if you'd like to submit some questions for the presenters or any of the presenters, please use the Q&A button at the bottom of your Zoom screen. And we will have a short Q&A at the end of the session. Okay, onward to our next speaker, Katia Pino, Technical Officer with the Global Coordination Mechanism on the Prevention and Control of NCDs, the Global NCD Platform Department at WHO. Over to you, Katia.
Thank you very much, Adam, for the to the organizers, PAHO, WHO Euro Vital Strategy for inviting me on behalf of WHO Global Coordination Mechanism on Prevention. Just a second here, there's a message, something coming there. Can you see my presentation?
Yes.
Okay, there's a message from Zoom here. It's my intention with this presentation to demonstrate the work being undertaken by WHO GCM to develop the decision-making tool for member states. So this tool is still under development, and this is important to highlight here. And I will try my best to explain how we are developing the tool, what is the tool about, and how we are developing the tool, because it's another important component on the process. So let me start with why we are working on this project. So member states, as you might know, through various high-level political declarations on the prevention and control of NCDs, have highlighted the role and the shared responsibility of the private sector in the prevention and control of NCDs. And some of those political declarations state that there is a need for strengthening the capacity of ministers of health to exercise a strategic leadership and coordination involving relevant actors, stakeholders, including other governments and civil society organizations, but also the private sector. So also WHO have recognized that many member states have limited capacity to establish cross-sectoral partnerships or collaborations across different stakeholders, or to manage their complexity during the implementation phase of those engagements. And they lack capacity to find common grounds, and while giving due regard to managing risks and conflict of interest. So this is why we are developing. But last year, even so, during the World Health Assembly, member states extended the current terms of reference of the Global Coordination Mechanism, the unit that I work, until 2030. So GCM is a member state mechanism established by member state, was giving 5 key priority functions, including one that is very important for this project, which is provide and update guidance to member states on engagement with non-state actors, meaning civil society organizations and private sector, including on the prevention and management of potential risks. So more recently, in the last executive board meeting in January 2022, member states noted and adopted an Agenda 7, which is an agenda for the NCDs, which includes actually the work plan of GCM and in particular the decision-making tool that I'm going to present it today. So let me brief on what we are doing to address the member state request. So my department, which is the global WHO Global NCD platform, is coordinating the developing of a tool that aims to support member states and other relevant actors in the assessment and analysis of critical elements to guide an informed decision-making process on engaging with private sector for the prevention and control of NCDs, while safeguarding, of course, the public health from undue influence or other risks associated with any form of real, perceived, or potential conflict of interest. So this is the tool, and we are calling here decision-making tool. So let me explain now how we are developing the decision-making tool, as you might appreciate the thorough approach and the importance given to this process. So first, we have set up a solid internal working group, we call informal consultative working group, with the request and support for our Deputy Director General, Dr. Suzanne Jacob. We established an this informal group represented by 45 plus members of relevant NCD-related departments and units across WHO, across the 3 levels of the organizations, in fact, headquarters, regional offices, and country's office, as you can see here in the slide. The overall purpose of this working group is really to provide guidance and input on the developing of the decision-making tool and ensure that there is a country-level relevance and fit for purpose in alignment, of course, with other WHO initiatives. In addition to the working group, we also plan external consultations in different moments of the developing phase. For example, during the outline of the tool and during the draft decision-making of the tool. This includes consultations with relevant external stakeholders, such as, for example, the participants of the Global Coordination Mechanism, which are essentially non-state actors, such as civil society organizations or non-governmental organizations and business associations. As of now, last year, we conducted the first consultation on the outline of the tool that we're going to see in a minute with members of the GCM, with the civil society organizations that are members of GCM. We also presented this outline to a group of experts on commercial determinants of health, and during a meeting that was actually held and organized by WHO by colleagues from the Department of Social Determinants of Health here in Geneva. In addition to that, we are collaborating with the Center on Commercial Determinants of Health at the George Washington University in the United States, and they are conducting an external review of the decision-making tool, the sections of the tool that we are developing. And finally, and very important so, we are preparing what we are calling the sense-checking workshops in countries to assess the understanding, the relevance, and the applicability of key concepts that we have in this tool and the approach that we are using to really deliver what we are supposed to deliver it. And we have confirmed already 4 countries to do the sense checking workshops, which are China, Botswana, Jordan, and Moldova. Let me first acknowledge that I would like to have, or I'd like to require much more time to explain in detail each of elements or aspects of this outline. But let me try to give you a very brief overview of what will be included in the decision-making tool. So the tool has been developed under the assumption that while leverage expertise and resources of private sector entities might be necessary in many countries, it's paramount that manage the risks, including conflict of interest, and mitigate interference ensuring that such engagement directly contribute to the implementation of national NCD responses, including those associated with a reduction of alcohol consumption. So as you can see in this outline, the decision-making tool contemplates the following sessions. So they have a glossary, which include, for example, definitions on private sector entities, what is meaningful engagement, and other important elements in terms that we need to put in place. The tool also addresses or articulates 3 overarching principles of private sector engagement, such as sustainable and responsible business practices, attainment of NCD goals, prevention and control in this case, as well as accountable and transparency governance. Those are principles that will help guide the process of apply the tool. The tool has a 3-phase approaches that guides the end users of this tool to assess, to analyze, and to make decisions to decide on whether and how to engage with the private sector. And again, weighting the benefits and all the risks associated with that, as well as the mitigation strategies necessary to conduct that. So phase 1 of the tool, as you can see there, aims to guide health authorities or the users of the tool on assessing the need, the capacity for leverage complementary efforts. They start from that. So why member states or governments need engagement with the private sector. So provide some guidance on that, including analyzing, assessing the national capacities, such as the local context. They identify the purpose of engagement and mapping potential private sector entities to address that particular challenge. Phase 2 of the tool aims to provide further insights on the detail of analysis of a prospective private sector entity in relation to modalities of engagement, because we know there are different modalities of engagement with different types of risks and complexities. Also discuss due diligence, discuss risk assessment and how to identify the risks and type of risk associated with that, mitigation strategies, and associated with a potential engagement. So phase 3 then is integrating all these elements, this information and analysis. It really guides the informed decision-making, taking into account the national health priorities, of course, and objectives of the country. And again, really putting the emphasis on giving due regard to manage the risks and measuring the conflict of interest. And so what we expect at country level. So in short, this tool is a tool and is just the way to support national and subnational efforts to prevent, to avoid, to manage risks, including conflict of interest, of course, while at the same time acting as an accelerator for building cross-sector capacity at national and subnational levels, identifying complementary opportunities where the private sector could contribute to advance the NCD gap. And my final slide, this is a tool that's still under developing. As I said, we still have consultations to be done. We still have meetings with our internal groups. The external experts are reviewing the tool. We are planning to have the final draft of the tool end of this year and launch the tool hopefully next year. So this is just in a very short time, just to provide you with a sense of what WHO is planning to launch in hopefully very soon on that regard. Thank you very much, Adam.
Thank you very much for that presentation, Katja. And now we're going to move to our next speaker, Paula Leonard. She's the National Lead for Community Action on Alcohol with the Irish Community Action on Alcohol Network and Alcohol Forum Ireland. Very pleased that you're here, and over to you.
Good afternoon, good morning, good evening, depending on where people are at. My name, as was said, is Paula Leonard, and I work in I work in Alcohol Forum Ireland, And I, since 2017, have been supporting the work of the Irish Community Action on Alcohol Network. And when I was asked for a title for today's talk, I decided on resistance from below, because we've heard a lot today from sort of policymakers and, you know, the different roles that people have, and researchers and experts. But really what we were concerned about was, what could we do at the level that we work at, in the communities that we work at, with the expertise and the knowledge that we have, and the passion that drives our work, and the activism that drives our work. And really, over the last number of years, we've been building towards the development of the IMARC and the IMARC toolkit, which contains both a summary of evidence and key concerns, and it also then has some tools for organisations who would adopt the IMARC to consider in relation to possible conflicts of interest. I suppose just to say that everything that we do in Alcohol Forum Ireland, we have a very particular brand of advocacy work, and that work is informed by all of the people that we work with. So the clients that access our alcohol-related brain injury service, the young people that access our youth work service, and the families that access our specialised family support initiatives for those impacted by alcohol and other drug harm. And all of the work of the Irish Community Action and Alcohol Network is informed by that bottom-up and that participatory approach. So just to move through to this piece, what are we talking about today? The IMARC. So the IMARC stands for I for independence, and also that we've got our eye on the ball and our eye on a fast-moving picture of the reach, the practices, and the influence of the alcohol industry and the impact it's having on our health and our well-being. So when organisations sign up to the IMARC, what we're asking them to do is to make a pledge. And that pledge is that firstly, they would review any partnership or funding proposals against the questions outlined in the IMARC toolkit, that they would sign up to never accepting funding from or entering into partnerships with the alcohol industry or its funded charities or organisations, that it would never use or promote alcohol industry funded materials or programmes in either educational or out of school settings with young people, that they would commit to scrutinising, challenging and raising awareness of the tactics of the alcohol industry in undermining public health in Ireland and beyond. And that beyond piece was really important to us, that we weren't just talking about social justice in Ireland, that we were talking about social justice in a global sense. And so the IMARC really was for our own sector in the first instance. That was the community sector, the voluntary organisations, the community-based organisations across Ireland, and civil society organisations, although we have had some conversations with others in academia and the research community about stretching the brand so that it may accommodate or may be useful to other sectors. So over the last year, we have developed a range of assets to support the IMARC. So first of all, I suppose there's the logo, and it's something that we would like that became visible and understood, that any organisation that had the IMARC had a very clear position in relation to industry conflicts of interest or industry interference. We have a brand kit for people. We have the IMARC toolkit, which I said includes the summary of evidence, and we've been blessed that we've had pro bono support and guidance from a number of global alcohol policy experts who've proofed that for us and given us sort of a quality assurance that's what contained within the summary of evidence is up to the mark. We have a membership form, which is really important, that it's a voluntary adoption of the IMARC, but that it was something that's across a whole organisation, signed by the chair, discussed by the board. On our website, we're making visible the growing support for the IMARC, and we have a standardised promotional slide deck, which I used in a different presentation earlier this morning. And really that's about making the IMARC easier to talk about, easier to understand, and easier to promote. So the drive for us was really about democratising public health evidence and cutting through what Nandita had described as the noise and the misinformation. And the other thing that we've been doing in our participatory approach towards this is we started last Friday with IMARC champions training. So those organisations that sign up, they can then become flag bearers, promoters of the IMARC. So we trained 18 IMARC champions last Friday, and that will be the first of what we envisage will be many IMARC champion training sessions. So I suppose just chatting to Lana about this, you know, where did it come from? What was the story? The beginning is never just one place or event. And the Irish Community Action and Alcohol Network was formed back in 2017. And that's an alliance of groups and organisations in Ireland that are committed to promoting and expanding and supporting the development of community action on alcohol across the island of Ireland. Other things that happened, I suppose I've cited there, the adoption by the Irish government in 2018 of the Public Health Alcohol Act. And I cite that because in the wake of that adoption, what we were seeing at the community level and the grassroots level was increased levels of interference and activity by the alcohol industry, looking for memberships of boards, looking to sponsor activities, partnering with those within our own sector. And for us, the so what moment came last year when we were very annoyed that one of our national sort of community and voluntary representative organisations were partnering with an industry funded charity to present their evaluation of their schools-based programs. And really we ran a successful campaign. They withdrew from that, but we questioned ourselves, how do we move from being passively angry to being active, and how do we move from being reactive to having something that's energizing? So I suppose that's the story of where we came from. And so we then developed a frame, and I think other speakers have talked about the importance of framing and why, you know, they're needed to change the narrative, to capture the narrative. But for us, it was really about raising critical consciousness across communities and widening the conversation, because often, I'm in this job 5 years, the conversations are happening with the people who are already well aligned and well informed about what's going on. And so in our frame, we had 6 key strategies. And I know when Jim spoke, he talked about the impact of alcohol and cardiovascular health and the denialism that's going on around that at the moment. But we felt that what we would do is pick 6. They may change. We've committed to reviewing these every year, but it was an entry point and a way to have a conversation that looked at the overall strategy of the industry instead of focusing on just one and a sector by sector approach. So the 6 we focused in on were, you know, the work that the industry is involved in influencing policy, the misinformation and confusion regarding cancer risk, the misinformation and confusion regarding risk during pregnancy, the ineffective and not evidence-based responsible drinking campaigns that are favoured by the industry, schools-based education, and we really describe that as a no-go area, and the emergence and sort of ongoing development and expansion of partnerships with government, state agencies, civil society, their CSR activity and the funding. And I think it's really important to say that we are very committed within the IMARC movement to not having a punishment model. So we know that there are charity organisations in Ireland that operate on a shoestring budget and that at the moment are dependent on some income stream from the industry. And what we are doing is making a call to government to say we no longer want that to be the case, that they depend on this funding. And to run essential services, really, there is a need for further support for, you know, women's domestic violence charities or for homelessness charities or for others that may currently be accepting funding. So the champions training I've already mentioned, but the champions training for us is really important because this really is about using a social movement methodology where each one can teach one. And the approach really was about exploring those 6 key causes of concern that I've just outlined, and discussing in groups, what are your thoughts, what are your feelings, what are your own experiences at the grassroots community level? Were you aware of these interference issues? Were you concerned about them? Do they matter? If they do, why? If they don't, why not? And what can we do about it? So that last question, the what can we do about it, really was about enabling people to act. And what we really felt was that in a lot of the effort in public health around reducing alcohol harm focuses on government action and alcohol control measures, and they're really important. But what we felt was that we needed to look at what we could do. And we do lobby government for change, and we do think that governments need to act, that it's a really important space and place to be acting, but it can be quite disempowering. It can take a long period of time, and you have no guarantee of success. So this was about empowering us with what we could do and changing the frustration into something sort of more active and proactive. Strangely and wonderfully, we launched the IMARC, Professor Tom Baber launched the IMARC for us in just the middle of March, so we're quite new. But even before we had launched, we began to grasp that there was interest in the IMARC as an initiative and as a global movement and at a symbolic level from various different people and organizations across the globe. And we've had conversations with people in Australia, in South America, in the US, in the UK, across Europe. We have been meeting and discussing and chatting to various different civil society organizations, predominantly some children's rights organizations. And people were wondering, well, how can we do something similar? So for us, we had to take a breath and pause, and we said, well, it's a social movement methodology. It's a new way of working in alcohol harm reduction. And we asked for just 5 commitments. We're very happy to share. We're very happy to see it grow. We can't be responsible for whether or not it gets teeth as it grows. And for us, the priority was, is, and will remain developing it here in Ireland. But for sharing it, we thought that there were 5 things that were really important. So the first was a commitment to a shared framing of the challenges, using the IMARC frame and those key causes for concern. The second was a commitment to engaging in participatory methodologies, so having a focus on critical consciousness raising. And so we felt we were recommending empowering learning strategies that enable people to see a different world, that alcohol harm isn't inevitable, and that the power and might and reach of and wealth of the corporations, it's not fixed, that we will always lose. A commitment to the co-production of knowledge. We felt that, you know, there's a lot of work happening in the alcohol harm reduction space, and we felt that while we wanted to be guided and supported by the experts, that really this initiative needed to be driven by communities, and there needed to be a model that respected and developed, embraced a co-production of knowledge methodology. A commitment to freedom of adaptation. I'm aware that I'm talking to many scientists who are, you know, very loyal to evidence and very loyal to methodology. But what we felt was that it's really important that groups, organizations, or countries that become involved in the IMARC, they're empowered and they have the freedom to adapt the IMARC to their particular economic, political, social, and cultural context. So, for example, in Ireland, the HSE has a very clear, the Health Services Executive has a very clear position on non-collaboration with the industry. We also are in the positive position that we do have a national standardized schools-based education program. So for countries that don't have either of those things, they may have to work in a different way. And the final one was a commitment to resisting over hierarchical structures. We are very loyal and very passionate about the belief that this needs to be a grassroots movement for change, and that it has a role to contribute to the overall effort that people like many of the people on the call today are doing now and have been doing for many, many years. So I suppose just in Ireland, on Alcohol Forum Ireland, we have a growing picture of who has thus signed up, and we're working in sort of the first instance with regional and local drug and alcohol task forces that have been around in Ireland, and agencies supports at the local level. At the moment, there are 24 of those nationally, and over 50% have signed up already to the IMARC. We also have a range of other groups and organisations. Some of you will be familiar: Alcohol Forum Ireland, Alcohol Action Ireland. We also have the National Youth Council have signed up, which we're really pleased about, and they're leading the way around conflicts of interest in relation to young people and aggressive marketing of alcohol in relation to young people. We've had Dublin City PPN that represents 800 groups and organisations across Dublin City, and we have the National Strengthening Families Programme and others. So we do have interest from many others that are in the process of signing up. So I think it's probably a little bit too early to name those. And I suppose for my very final slide, and I may be the only speaker today that has come in under time, it was just about naming and acknowledging the importance of the fact that I may be sitting here talking to you today as Paula, but I am only representing the voices of the communities across Ireland that have developed and been committed to this journey over the last number of years, and that are actually quite excited that we've developed something that we find is user-friendly, usable, and hopefully effective in this space. And I'm going to finish with a quotation from Margaret Mead, which is, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." So I'm delighted to be here, and thank you all very much for the opportunity.
Thanks very much, Paula. And thanks to all of our speakers for their contributions, their presentations. We have a brief time now for some questions that I'll pose to the speakers. And we'll go back to the beginning. Jim, perhaps address the first couple of questions to you. Could you elaborate a bit on approaches at the sort of individual level for particularly early career researchers, and then some of those institutional strategies that you were referring to that are so important to become aware of and mitigate the issues and risks of conflict of interest? So some practical recommendations. And then I'll just add the second question onto that. Second question, are you seeing increasing alignment in the research community around this? You definitely presented a fair range of approaches and of practices. Do you see an increasing alignment, decreasing, or what are the trends?
Okay, just to add a little to what I said earlier, for early career researchers, it seems alluring that there is a research grant available from an industry body, and that can be the key thing that can kickstart your career, which is often difficult to do. And the experience has been, and the consensus that has now emerged, is that however alluring that may seem, it is deeply problematic to accept such funding, and alternatives should be sought. And that view has been arrived on not only amongst people who would ordinarily and historically have been skeptical themselves about industry funding, but that it would be the recommendation that comes from senior researchers who have had previous relationships with industry funding. So the experience has been industry funding is very, very divisive. So if we as a research community are to move forward and make our research more useful, then allowing any industry involvement feel unavoidably problematic. So in terms of alignment, can you remind me of the question again?
I was asking, or I was conveying the question around, do you see trends in the alignment of the research community, of researchers? Do you see this mix of approaches? Is the heterogeneity, persistent, or do you see any trends in folks getting together on the ways forward on this?
Sure. So there has been little or no prior study of the issues I presented the qualitative data on. There have been debates within scientific journals which have been very, very polarized, around a binary, should we accept industry funding or not? Those debates have been very rancorous, and among participants in the interview study, regardless of their positions within those debates, there was a sense in which that was not the way forward, and getting sort of hung up on that, blocking attention to the bigger issue. And so there is there were very, very few exceptions to the common ground that I described. It's about moving forward as a research community, making the case to research funders that to make research useful to society, that requires investment in research in order to keep industry funding from being alluring, particularly to early career researchers.
Thanks for that. I think, highlighting, as we do in public health all the time, there's individual level strategies, but the larger drivers, the more important drivers of this are the structural ones, the institutional ones, the contextual ones. Thanks very much for that. Nandita, perhaps I'll direct, and I'll invite speakers, if you want to respond to your colleagues' questions or build on it, please feel just go like that, and we'll do that. So Nandita, thanks for your presentation. A couple of questions for you, maybe the same question around civil, but maybe on the CSO side, on the civil society side, alignment around common approaches and agreement on principles. Perhaps experience from the tobacco on that. If you could comment on that question, and on the issue of monitoring industry practices and collecting data on industry practices. Perhaps you can comment on the importance of that. You referenced it, and maybe also an example of how that's put into practice, maybe from tobacco.
Okay, I'll start with the second and then go to the first. I think the monitoring of industry practices is crucial, and particularly in the context of social media, a real true challenge. It's a challenge not just because effective implementation requires cross-border cooperation. Often this kind of messaging, the marketing, the practices originate from one jurisdiction into another. And for this to be effectively enforced, it requires cooperation between the different jurisdictions. So that in itself is a challenge. But beyond that, what practices look like online is an entirely new and evolving set of behaviors. So for instance, what we've observed in tobacco, it's no longer just simple advertising to get product market share, but it is about creating peer endorsements. It's about using influencers. It's about using a set of activities that typically, belie definitions of advertising. So there's, and then tracing the money. How does one even trace the money, the funding? So marketing, online presences, and industry activity is an incredibly crucial but challenging thing to do. And this is where civil society participation and public participation is crucial. So the way we're approaching it in tobacco control is through crowdsourcing as well. So it's a two-way dialogue, both encouraging inputs and then engaging back with public, with civil societies, and ultimately governments in better enforcement. The issue of alignment is a tricky and an important one as well. I've seen, what do we mean by conflict of interest? What are the spaces in which we can define when engagement can and cannot happen? Those are the sorts of questions that frequently come up. And I think through debate, coming to some agreement is vital, but this is also where learning from the experiences of other industries can be crucial, and fundamentally making some decisions around not allowing for certain actors to be at the seat at the table when decisions are made around policy making. Those are fundamental to getting alignment. Did that answer your question, Adam? If I missed
of course. Okay, maybe over to you, Katja. Thank you for the presentation about the tool and the work of WHO in this area. Could you just talk about, just sort of further elaborate on some of the next steps in terms of, would you envision, or do you envision tailoring the tool for different types of industries or products? Are there, incorporating the unique aspects of different industries? And on the same theme of tailoring, would you envision tailoring to different levels of government? National, subnational, urban, different types of decision makers within government around this. Can you just say a word about how to make the tool as useful and as widely applicable as possible?
Yeah, thanks very much, Adam, for the question. It's an important one, and we are as we are developing the tool, we are gathering, more experience and more needs from the country level. So that was very important, that we are developing this tool with our country focal points in place, providing us really practical situations and in different scenarios and in different type of industry. It's a challenging exercise that you are undertaking, as you probably recognize already, because we are dealing with a whole range of industry in the area of NCDs. But of course, we are very concerned with the conflict of interest and risks associated with that. We understand that any type of engagement with the non-state actors or private sector has a risk, and the ministry and the governments has to understand that. So, and the tool will be as generic, as narrow as possible. So we are trying to balance the challenge. And what we are aiming to do, envision this tool being implemented in countries, that we will align with other instruments that WHO has already developed. For example, conflict of interest with the ultra processed food. There is already, PAHO has developed already guidelines on that. So we want to link those specific aspects of a particular industry, and then bring more rich in the assessment of, in this case of conflict of interest. We understand that the area of alcohol is also willing to develop something similar. So we are trying now to make the connection with other works in WHO, because this is more related to the conflict of interest assessment of risk. But the tool is broader than that. That doesn't look only on the conflict of interest and interference of the industry. Really pose the questions for the governments. And now comes to your second question: can be national governments or can be subnational. In our view, as of now, can be either, and even can be considered to another areas of within the health spectrum, because we are trying to be as practical in the questions that we are framing for reflection as possible. So in a short sentence, yes, it's possible to apply, and yes, we should, and countries and regions should adapt, use part of the tool together with their own specific area, in this case, alcohol. Over.
Thank you. And Paula, last a couple of questions for you. Could you talk about any resistance, any opposition, any sort of pushback that you've experienced to the efforts, and characterize sort of what that looked like and what how you approached it? And also, second question, could you talk about sort of what data points or data elements or arguments would you say have been the most compelling, have been the most wide-ranging and appealing? Or are you seeing a lot of heterogeneity in the stakeholder engagement around the issues that they care about and what resonates the most? Or are you seeing a lot of commonalities? Maybe you could talk to that as well.
Okay. In terms of resistance, we've had surprisingly little, actually. We found that more people are interested and aligned and ready for the conversation than maybe we had even assumed at the beginning. And most of the organizations we've approached have either signed up or are in the process of signing up. That said, we did start with organizations that we felt might be the lower hanging fruit. So the resistance piece may come later. We're not engaging as yet with organizations that we know are in receipt of funding, and that will be more difficult and complicated for them. The other thing that has happened that we have noted and seen is that we are receiving more approaches from the alcohol industry to participate in stakeholder consultations, that we would be paid a little amount of money for that, to a charity of our choice, those sorts of approaches. And I've been logging those because that's an interesting development for us. In relation to, I suppose, what data points have been particularly of interest, I think one of the things, the frame has been really useful. The 6 key strategies has been really useful, because what it's allowed people to do is take a step back, and rather than reading one article and one theme, it's allowed people to kind of join the dots and go, oh my goodness. But so for example, regional and local drug and alcohol task forces are interagency. So they have local government, education providers, health services, police on those. And I think in those discussions, the ones that have hit a nerve or that people have asked the most questions about or been interested in is the misinformation in relation to alcohol and pregnancy, the misinformation in relation to cancer, and the third one, which is really strange because they're hiding in plain sight, we've had several politicians who have been quite shocked that an alcohol industry funded charity is delivering schools-based education in Ireland. And they weren't aware that that was happening. And they were very shocked about that and want to raise questions in government and, with Parliament about those. So for us, we kind of thought that information is publicly available. We're not telling people anything that they shouldn't know as, engaged citizens. So really, I suppose the learning journey on this has been really quite interesting and refreshing, but also an acknowledgement that there's quite low population level awareness and even sectoral awareness within our political class around some of these conflict of interest issues. I don't know, does that answer your question?
It does. I think it does. Thank you very much. Okay, well, thanks to all the panelists again for your presentations and thoughtful responses. I'm going to, in the last few minutes today, invite Karina Ferreira-Borges, the Acting Director for Non-Communicable Diseases at the WHO Regional Office for Europe, to offer us some closing remarks, some takeaways, and to conclude the session. So over to you, Karina.
Thank you very much, Adam. And can you hear me well? Good. Good. So thank you. First of all, I would like to thank our panelists and all the entities that we had in this event. We had quite a lot of people attending, and I would like to thank all of you for making it so successful. I really enjoyed all the discussions, and thank you, Adam, also for moderating the event. I would also like to thank Vital Strategies and also my colleagues in PAHO. It's been a pleasure to be working with the teams, with the different teams, the team in PAHO, the team in Euro, for the vision and for organizing this session. We have been for long discussing these topics and the importance of having such a kind of webinar, and I'm very happy that we could do this today. And we really appreciate the hard work from all the teams that were involved in organizing this event. As you heard today and through all the presentations and discussions, we know that we have a need to address harms that come from alcohol in our regions and globally. Maristella started by mentioning the burden that we have in the Americas, but Euro is the same. We have the 2 regions in the world with the highest levels of alcohol per capita consumption, and also with the highest contribution to all-cause mortality due to alcohol. So indeed, it is an imperative, it is a public health imperative that we continue the discussions and that we do more, because we need to progress more. Those of us that have been working in this field for a long time know that we have the solutions. This was also mentioned here. We have the best buys. We have what we know are effective evidence-based policy population level strategies, which are outlined in the SAFER as also presented, and they are the tools which are more important for saving lives and ensuring that we have healthier communities. However, we also know that unfortunately, these policies are not implemented, and we know that they also reflect the challenges that we have been seeing here, notably, how to address conflicts of interest, how to make sure that there's no interference from the industry in the policy domain, and particularly in public health policies. So I think we must continue to acknowledge that we have current policy gaps, and the reasons also that they persist are also due to many of the things that were highlighted here. And thank you also for the studies that were presented and the results that were presented. We know that research is biased by interference of alcohol industry, by funding issues. And it is also something that we need to consider because this is happening not only in the alcohol field, but the alcohol field is more critical. And we know quite a lot of civil society associations that closed doors during the last years because they were underfunded, and where they were funded, the funds were cut. Also to, in a way, not allow them to be so vocal. So for tobacco, we had the opportunity to have very vocal civil society organizations, which are key for the policy process and for moving some of these complex agendas. As we were just listening, suddenly we raise awareness that it's industry that or some charity which is funded by industry who is supporting, school-based programs. And before, if there was no such a movement, nobody would know. So we need to really rethink also what and how we're going to ensure, the funding and the support for civil society organizations to continue also in their role in a way that allows them to work and to continue on their path to support public health as well. We have heard here that conflict of interest and interference in alcohol policy making continue to act as barriers. It continues to act to creating and implementing sound health policies on alcohol. And we also heard many examples, as already said, in the research community, initiatives, and even in government. And it is crucial that we understand the history, that we are aware of the tactics that are used, and also the strategies so that we can effectively counteract them. I think that we also heard quite a lot of positive messages from our experts and discussions, and we need more time to focus on what we heard here today. We have listened to some inspiring stories. We have listened to community-based resistance to alcohol industry interference, which we hope will also be used as a model for others looking to creating healthier communities in their own countries. And we also learned some very valuable lessons about how to address conflicts of interest in the spheres of research and policy making. I think these are all lessons that we need to take into our own work, whether that be in government, in academia, or even at the international level. And I believe this is cause for optimism in moving forward in this area. Once again, I would like to thank you all the speakers that came in, that shared their expertise, that shared the examples of good practices so that we can move forward in our missions to be able to create good public health policy and healthier communities which are free from alcohol harm. So thank you very much for giving me the opportunity to close the event, and I wish you all a good rest of the day or a good start of the day, depending on where you are connecting. Thank you very much, Adam. Thank you.